Okay, so today let's check out some interesting orthopedic surgery TikToks with you guys that I have stumbled upon, and maybe I can share with you one or two things about what I do on a daily basis. I hope you like it. Now here goes the first one. It's by a doctor, I guess, called Vladimir Shionei, something like that. It looks like this is actually the most watched orthopedic surgery TikTok. And I can see that it has a whopping 1.4 million likes. So let's see what is happening. Just a normal day in OR is operating room. Part 2. Actually, it might look strange, someone hitting something out of someone's leg, but the truth is orthopedics is one very laborious discipline. I guess amongst all surgical specialties, we use the most force because really we deal with bones. So what's happening in this video is you can see someone here, the surgeon is trying to hit something. This is actually a nail. A nail is used to fix fractures, usually fractures of long bones. It's just a sort of long piece of metal that is put inside the canal of your bone. This is an extreme case, but to remove a nail, you might want to use force. Usually we do what is called backslapping, and that's what the surgeon is doing it here. You're sort of hitting it backwards so that you get the nail out of what looks like probably the patient's tibia in this case. That is the bone in the leg. We actually use tools like saws and mallets and other metallic equipment. So yeah, that is orthopedics for you. Okay, next we have another one here by Corey Kalendin MD. That is another bone doctor, as you can see. And this one has 6,300 likes. Let's see what's happening. A question is posted there that why is surgery so expensive? Okay, there's a surgical robot that costs $1.3 million. Looks like he's posted the pay scale of a nurse anesthetist and a surgical nurse over there, $90,000 probably per year, $170,000 per year. Makes sense why surgery would be very expensive. In our case over here in Kenya, definitely things are much more cheaper than what I'm seeing here. When you look at some of the places some of us work in the counties, yeah, we don't use this much expensive equipment, but we have what it takes to actually fix bones. There's the bare minimum we can say that you need to safely perform surgery, and that's what we use. Yeah, and the average operating room cost is $62 per minute. That's like 7,000 Kenyan shillings per minute. That's quite expensive over there. Over here, we don't actually charge per minute. There's many private hospitals that do charge the time you'll spend in theater per minute. But in the counties, government hospitals, there's just a blanket theater fee. In my case, it's only 6,500 shillings where I work. So the amount of money here that is paid per minute is what we charge for the whole session. Whether you take 10 hours or 5 hours or 5 minutes in theater, you'll pay 6,500 shillings where I work. And yeah, 350,000 to 700,000 shillings for a surgical saw drill. Yeah, that's true. Even the ones we use over here also cost about 400,000 shillings for a drill. It's not the drill that is in the hardware shops, because this drill can actually be sterilized. That's like we can actually autoclave it, sort of heating it to some temperature and pressure so as to get rid of literally all bugs so that we can actually use them in surgery. That's why they are very expensive. Okay, next here we have a TikTok by Plaster Master 78 2 days ago, but it has a whopping 57,000 likes. Okay, what's happening over here? Thumb spiker full cast. In our setup, we as surgeons mostly apply casts, and casts are those plasters in theater, but most times in the outpatient department, guys who come to the hospital with like a broken limb will be casted by like a plaster technician or someone after maybe a doctor reviews them, depending on how bad the injury is. A thumb spiker is literally just a cast that from its name supports the thumb, or basically this side of the hand when one has like a fracture, dislocations, an injury on this aspect. And as I can already see, this guy is offering very high standard of care. As you can see, he's already put on a sock and so many other bits and pieces are coming up. And you can see he's doing his work very meticulously. Literally, when you get a cast in one of the county hospitals, chances are all that will be applied on you is this. What he's doing right now is called a soft burn and the cast. Only 2 layers, the soft burn and the cast. These other things are luxuries, as it were, that you'd get probably in some nice private hospitals. But then they're actually stuff that, according to books and so on, we're supposed to do. They offer better padding, nice protection to the limb, in case you have like a reaction to the cast and so on. But in our setup in the counties, the budget does not allow this kind of care. Anyway, the truth is some of this stuff is actually not that expensive. We just don't have a nice government that can, give us this. Anyway, I should say that this kind of cast that he's used is actually quite high-end, not the usual plaster of Paris that you'll probably be getting if you go to one of the low-end hospitals that is white and messy. You guys know that stuff that looks like chalk. This is fiberglass, I guess. So yeah, nice work. Okay, next here is a funny one from Hello, I am Thepper, and it has 26,000 likes. Let's check it out.
Anesthesia? Excuse me. Yeah, what's up? What's the patient's blood pressure? They're bleeding all over the place.
So as you can see, the surgeon is actually asking the anesthetist. The anesthetist is whoever gives the patient the medication to eliminate pain and basically keeps them alive throughout the surgery. So yeah, the surgeon tends to complain to the anesthetist that what's the patient's blood pressure? They're bleeding all over the place. Sometimes it's true that when the blood pressure of the patient is high, they tend to bleed a lot. But there are times that, bleeding is because of some other reason, like the patient has some clotting issues, or maybe you've not stopped all the sources of bleeding. And so sometimes anesthetists tend to make fun of us surgeons that when we see that the patient is bleeding, we keep on asking them to lower the blood pressure instead of actually doing something to stop the bleeding.
It's 95/60. Can you bring it a little lower? I can't see anything with all this blood in my face. I can try, bring it a little lower, but I can't bring it too much lower than that. But I need the patient to stop bleeding so I can fix the bones. Okay, pressure's down to 90/50. How's that?
90/50 is already quite some low pressure. So the joke here is that, you see, the blood pressure is not the cause of the bleeding. The surgeon is only just blaming the anesthetist for no particular reason.
90/50. How's that? The patient's still bleeding. I really need it to stop. I'm sorry, Dr. Smith. I can't make the patient stop bleeding. Kind of have to keep them alive. But the bones!
So yeah, other specialties tend to make fun of orthopedic surgeons that, we just want to fix bones. We don't care whether the patient is alive or not. So that's the joke over here. Okay, next. Okay, this is called a giggly. So it's basically just a string of wire that we actually use as a saw to cut bone and so on. Yeah, despite the fact that nowadays we have power tools, we use power saws to cut bones. But yeah, the giggly saw is still very much in use. It's just a piece of string that you kind of do like this and it cuts bone. Yeah, that's a demonstration of what it does, used in amputations and so on. It's a nice one by Dr. Michael Hay, an orthopedic surgeon. Next. This is another one by Dr. Neil Blitz. That how many lollipops does it take to marinate a foot or a leg? But really what's happening here is they're basically just cleaning the leg in preparation for some procedure. Okay, it looks like they're not scrubbed, like they've not put on those gowns that are used in theater. So it means that this is probably not theater, or if it is, it's probably a procedure called a pre-wash or a social wash. We always wash legs and hands and any part of the body before we actually operate them. Over here, we just use soap and water, but what they're using here has some iodine in it, and that's why it looks brown. So that's the reason they're saying that they're marinating the leg. You see, like how you'd marinate a chicken. Yeah, so that's really what we do. We just wash limbs before we operate. It's simple. Next, this is Orthobuzz with 311,000 likes, 5-star PA scrubbing. PA is physician assistant. It's like an assistant to a surgeon over there in the States. Here, most times your assistant in surgery will either be another surgeon or maybe a medical officer, depending on where you are, or sometimes even a theater technician. There's some guys who are actually trained as theater technicians. They know the stuff that happens in theater, though they are not surgeons, but they can actually assist you. They can scribe into the surgery and assist you. So this is strange. There's some sort of like pipe that is coming out of her back. Okay, it looks like it's some sort of pipe that brings in warm air, because you see the surgeon likes it cold in the operating room, but the PA freezes. Yeah, so they are becoming creative. This is not what is done everywhere. Yeah, you can see that is a warm air blowing machine. Okay, it happens even over here. Most theaters, not most theaters, but a lot of theaters have some air conditioning. And so, especially in orthopedics, like you saw in the first video, it's actually a very tasking kind of surgery. And many times you will actually sweat. So many orthopedic surgeons will want like the temperature of the theater to be reduced, like they want a cold theater so that you see you don't also get too hot. So yeah, the surgeon might want a very cold room, but the assistant is actually uncomfortable. And so you can see here they have some machine that blows some warm air into the assistant. If you're an assistant surgeon here, you just have to brave the cold. If the surgeon wants a cold theater, that is it. This is 5-star stuff. Happy PA, happy surgeon. Yeah, it's true. If you have a bad assistant, most times in surgery, you suffer. Okay, next is this one by someone called Aaron Kubal. 7,000 likes.
You'll be shocked at the new research showing the most common orthopedic surgeries might not be that effective. Published last week, this paper looked at the effectiveness of the 10 most popular orthopedic surgeries compared to placebo, non-surgical treatment, and no treatment.
Okay, a paper from the BMJ, the British Medical Journal, probably something credible. Common elective orthopedic procedures and their clinical effectiveness, umbrella review of level 1 evidence.
These findings have raised a lot of eyebrows. ACL reconstruction versus non-surgical care, no difference in patient-reported outcomes. Partial meniscectomy, no better than non-surgical management. Rotator cuff repair, no benefit over non-surgical care. Subacromial shoulder decompression, no improvement compared to other treatments. Lumbar spine.
So what this paper is saying is that some of these surgeries that are done electively, like they are not emergencies, are not really effective compared to like treating those conditions without surgery. And some of them have been mentioned, like rotator cuff repairs and so on. Okay.
Spine decompression, similar to non-surgical treatment. Lumbar spine fusion, noteworthy complications, and no better than non-surgical care. So what?
Yeah, there are operations that we actually know are no much better than actually not doing the operation, but there's other factors to consider. An example is for some of these operations like an ACL reconstruction, that is like the anterior cruciate ligament. It's one of those ligaments inside the knee which might get torn in a sports person, for example. I would say that performing the surgery sometimes is not just because of like whether or not you do the surgery, it will still heal or something. Sometimes it's an issue of, number one, time. A quick example I can give is if Cristiano Ronaldo, for example, got a torn ACL, it would be very critical to operate on him and repair that ACL or reconstruct it rather than someone who is just, a farmer in the village who is 60 years old. You see, occupation, time to recovery, and some of these things actually dictate whether or not you'll do surgery versus just letting the stuff heal on its own.
What should you do with this? Remember, your doctor should tell you about a treatment's effectiveness compared to other treatment options. And if they don't, you should ask for that information and tell them what you've heard.
Yeah, on that one I agree with him. It's a good idea actually for all surgeries to get an idea of what happens if we don't operate. What happens if we do the surgery? So you can make an informed decision on whether or not you want to get the elective operation done on you.
This doesn't mean those surgeries are useless. It means you might have other options and you should be told how they compare.
True, it's a question of options.
A lot of surgeries haven't been impressive and we need more trials comparing them to non-surgery.
Next, this is from Dr. Michael Hay again. I think he's one of the orthopedic surgeons that actually post on TikTok quite a lot. And 11,000 likes. One of two elbows today. This one was broken, snowboarding. Okay, what's happening here is basically a wire has been pulled out of the elbow. I guess this should be like a child. Mostly in children, when they get fractures around the elbow, mostly what we call a supracondylar fracture, we treat it by wiring. That's like doing pins across the fracture to like hold it together so that it can heal. We use X-rays to place the pins just through the skin into the bone. So this is what happens when the pins are being removed. They're just being pulled out using a pair of pliers or something. Next, orthopedic surgeon problems. Okay, this stance that this guy is taking, I think, oh yeah, it's because the assistant here is short. So the assistant is helping him put on that gown over the head. And in our case, we don't really put on this head gown stuff. This is Africa. We just put on a mask, some eye protection, and a cap over the head, and we're good to go. But probably some high-end hospitals do this kind of gowning. Okay, yeah, so that is what I had for you guys for today. I hope you've learned something about what I do on a daily basis as an orthopedic surgeon, and maybe some interesting TikToks if you'd like me to do this kind of videos every so often. Comment down below, tell me which one was the best, which one was funny, what new thing did you learn about surgery. As always, if you're not subscribed, please subscribe so that you do not miss any of such videos. And smash that like button on your way out. See you in the next one. No pressure.